Okay, so schizophrenia. Schizophrenia is the reading on page 589 to 597. So schizophrenia is a psychological disorder involving distortions in thoughts, perceptions, so you start seeing things or hearing things that aren't there, and your emotions. This is a disorder that people used to refer to as the madness, psychosis, or insanity. 1 out of every 100 Americans are diagnosed with schizophrenia. 2 million people over the ages of 18 are affected every year. For men, schizophrenia usually shows up before the age of 25 and between the ages of 25 to 40 for women. So usually men are diagnosed earlier than women. Currently, schizophrenia is diagnosed for over 40% of the patients in public mental hospitals. This may be due to the fact that there is no cure, and oftentimes patients will need therapy for the remainder of their lives, and it really is a hard disorder in order to function in society or maintaining a job if you don't have the ability to pay for therapy and pay for meds. Nearly 1 out of every 100 people, like I said, are diagnosed with or develop schizophrenia, and then 24 people worldwide suffer from schizophrenia. So 2 million specifically in the United States and 24 million worldwide. What does it look like? For sufferers of schizophrenia, the mind can be twisted in terrible ways, and it can become very overwhelming and filled with stimuli, hallucinations, and delusions. In schizophrenia, emotions become blunted and thoughts. Let's first talk about this disorganized thinking. That's a big part of schizophrenia. Thinking is fragmented, bizarre, and often distorted, so it's very deviant. This is often known as delusional. The breakdown in selective attention takes place. They cannot concentrate on one task. So I can concentrate on reading this to you, but they're dealing with reading this to you and listening to other things or seeing other things. There's a lot of stimuli in their environment that's impacted. They often say that the thalamus, which is responsible for our, it's the brain switchboard, which we've learned about before, which controls all of our different senses. They say that in somebody who has schizophrenia is severely shrinks throughout their life. Word salad is another problem that they deal with. It's the language that takes a strange term. It's jumbled ideas and formulates jumbled sentences. So it's a sentence that pretty much does not make sense, and it has a bunch of different terms in it because of all the stimuli that they're receiving in their environment and the lack of selective attention. So here's an example of somebody who has word salad. The line will have to change from dogs into cats until I can meet my father and mother, and we will depart some rats. I live on the front of Winton's head. You have to work hard if you don't want to get into bed. It's all over for a squab true tray, and there ain't no squabs, and there ain't no men, and there ain't no music, and there ain't nothing besides my mother and father who stand along upon the island of Capri where there is no ice. Well, it's a suitcase, sir. So this is an example of word salad. Second thing I wanted to talk about is disturbed perceptions. Hallucinations take place, which are sensory experience without sensory stimulation. So you see stuff that's not there, you feel stuff that's not there, you start hearing things that aren't there, tasting things that aren't there, and smelling things that aren't there. Auditory is most often the one that is dominant in one's life, and it can also often be negative. Okay, another category that you should know is inappropriate emotions. It is when somebody has absolutely no filter and they don't understand what's real from what's not. They could be emotionless, which is known as flat affect, and expressing no emotion at all. So what is the onset or the development of schizophrenia? Usually, as one is maturing into adulthood, they find themselves having symptoms of schizophrenia. It impacts females as well as males about the same amount. Men are often diagnosed earlier, however, and it is more usually severe. Some of it develops out of stress, and some develops gradually. So a stress can be a trigger that brings it out, but some develop it gradually over time. There are positive and negative categories of schizophrenia. Oftentimes, researchers now characterize symptoms of schizophrenia into positive or negative. Positives refer to active processes. It's very, you can see it in terms as they see delusions or hallucinations. They talk to the delusion in delusional ways and are inappropriate. Negative symptoms refer to the passive process, and they're very socially withdrawn, so they're not active on the symptoms. They may be motionless or emotionless. So the developmental process in terms of how fast does schizophrenia come on to an individual, sometimes it's the chronic process in terms of it's very slow. However, the behaviors are they exhibit persistent and strong effects. It comes on very slow, but it comes on very strong, and it's very hard to recover from it. Acute process is it develops very quickly over the course of a year. And they say it's easier to adapt in therapy and taking and to be able to become maybe clinically medicated and balanced in this area. Okay, so here are different types of schizophrenia, all falling under the schizophrenia criteria. One is paranoid. It's where you could be preoccupied with delusions and hallucinations, so you keep hearing things and you keep seeing things, and it's often very relevant in your life. Another one is disorganized. Disorganized schizophrenia may be more that you are speaking. You're exhibiting patterns of behavior in terms of speaking that is different, or word salad, or maybe you are having problems with speaking at all, and known as the flat or inappropriate emotion. Catatonic, your immobility or excessive, purposeless movements. So it says on there it's extremely negative, and it's parrot-like repeating of another speech or movement, so you're pretty much immobile, you're not speaking at all, or maybe you are mimicking somebody else. Undifferentiated is many and varied symptoms, and residual, which means you're withdrawn after the hallucinations and delusions have disappeared. So you can be going through different types of schizophrenia at different points. Originally, they thought schizophrenia was a result of a defective parenting or repressed childhood trauma. Not only is it the one that is the most dreaded, but often is the one that is the most researched. New research links brain abnormalities and genetic predispositions as the leading causes right now to schizophrenia. So it isn't as a result of the defective parenting and isn't a result of repressed childhood. What you're actually going to see is there are brain abnormalities. Dopamine is a big indicator here. They have excessive amounts of dopamine in the brain. The excessive amounts start creating hallucinations. There are drugs that can increase the production of dopamine. Cocaine and meth both alter the amount of dopamine that is released in your brain. That's oftentimes when we were watching the video on meth, you saw the people exposed to meth hallucinating and hearing things that aren't actually there. Abnormal brain activity. There is low functioning in the frontal lobe, which we know deals with reasoning and thinking. There's actually the shrinking that takes place in the cortex, and shrinking also takes place in the thalamus, and the thalamus is the switchboard for sensory information, so that's why sometimes you may have issues with sending sensory information. Causes of schizophrenia kind of continued in different areas of the brain that could be impacted. There's a loss of cortex. MRIs, we talked about those before, that look at brain tissue, were created after repeatedly scanning 12 schizophrenic subjects over 5 years and comparing them with 12 healthy brains scanned at the same age and intervals. What you're going to see is there's severely loss of the cortex. It's indicated by the red and pink colors, while stabilizing regions are in blue. Okay, so you have on the earliest deficient, they started scanning the areas, and as you could see at the top, the red and the pink areas are where different parts of the brain slowly become deficient at first, and you can see the front portion of the brain, specifically on the left temporal lobe, begins to decrease early. Okay, on the bottom, 5 years later, you're going to see even more decay that starts taking place on all areas of the brain. Okay. Maternal virus. Are people at an increased risk of schizophrenia if during the middle of their fetal development their country experienced a flu epidemic? The repeated answer is yes. Flu is something that is very, needs women who have the flu during pregnancy is something that they need to make sure that they're preventing. Are people born in densely populated areas where viral diseases spread more rapidly at greater risk of schizophrenia? The answer, confirmed in a study of 1.75 million Danes, is yes. Are those born during the winter and spring months after the fall-winter flu season also increased risk? The answer is yes again, to 5 to 8% are high at risk. In the southern hemisphere, where the seasons are the reverse of the north hemisphere, are the months of above average schizophrenia births similarly reversed? Again, the answer is yes, though somewhat less so. In Australia, for example, people born between August and October are at greater risk unless migrated from northern hemisphere, in which their risk is greater if they were born between January and March. Are mothers who reportedly being sick with the influenza during pregnancy more likely to bear children who develop schizophrenia? In one study of nearly 8,000 women, the answer was yes. The schizophrenia risk increased from customary 1% to about 2%, but only when infections occur during the second trimester. So during birth, a big thing that women need to, or during pregnancy, a big thing that women need to avoid is any type of viruses, being exposed to any type of viruses. They don't know exactly the cause of schizophrenia, but this is a high indicator. Okay, other things to consider, is it really genetic? 1 to 10 average people get schizophrenia. Now, if your family member gets it, 1 to 10 people end up getting more diagnosed with schizophrenia. For identical twins, 1 out of 2 people are usually diagnosed, or they share the ability of getting schizophrenia if your identical twin has it, so there's a 50% chance. However, you often have to take into consideration you're also sharing the womb. So just because you may think that they have the same genes, they also have to remember that they have the same womb. And then for fraternal twins, it's the same as an average family member. It's 1 to 10. People who have identical twins who suffer from schizophrenia have a 50% chance of suffering from the disorder too, even if they were raised in separate environments. Similarly, a child with one parent suffering from schizophrenia has a 13% chance of developing the disorder, but a child of 2 parents with the disorder have a 46% chance of getting schizophrenia. What are some early warning signs for kids? A mother whose schizophrenia has severe and long-lasting, so if you have a mom who's schizophrenia, you have birth complications involving oxygen deprivation and low birth weight. You have a separation from your parents. You have a short attention span and poor muscle coordination. It's disruptive and you're usually withdrawn. You're emotionally unpredictable and you're poor peer relation and solo. You like to play alone. So these are signs in which you may start seeing in other kids who have developed schizophrenia or young adults who develop schizophrenia. These are some of the early warning signs. And the last thing, we're going to get more into it, but the treatments of schizophrenia, much like the treatment for all psychological disorders, the treatment of schizophrenia has come a long way. They used to do lobotomies and insulin shock therapy. Current treatments, however, usually are a combination of therapy and medication. The impact of many drugs, the major tranquilizers which inhibit dopamine can suppress the symptoms of schizophrenia. They usually use tranquilizers at first to kind of stabilize you, and then drugs will provide an excess dopamine, which can cause schizophrenia type of behaviors in schizophrenia. So drugs that provide excessive dopamine can cause you to have maybe potential schizophrenia.